take you back to that briefing by the family of the late Shonisani Lethole. Hopefully the technical issues have been sorted out. Let's listen in.
Medical reports when handing over to colleagues, which had a serious impact on the clinical management and oversight of this treatment. Remember, these are the people who belong to the ethical body. The Ombudsman's report concludes that the care rendered to Mr. Lethole was not only substandard, but also reckless and negligent. And that aspect of this care represents gross medical negligence. There were also major systemic failings in implementing standard policies and COVID-19 protocols, some of which the report makes clear that have been going on for some time. The report clearly illustrates why the hospital infrastructure is not suitable to serve as one of the 3 COVID-19 hospitals in Gauteng. For example, Shonisani's condition was not properly assessed in line with COVID-19 protocols on arrival. There were challenges with COVID-19 testing and resulting processing. Wards were not properly demarcated, so increased the risk of mixing COVID and non-COVID patients and raising the risk of in-hospital infection. Additionally, the report also makes clear that the poor oversight of medical care has been going on for some time. One of the worst examples given is the keeping of inadequate medical reports, an issue which has been raised by unions and workers in previous meetings with management. It is important to recognize that this is the leadership of the hospital and the most senior medical professionals that are responsible for this failing. I just want to comment something on the keeping of reports. I was once being a grade 1 teacher. Those kids were having books which were supposed to be put in order, and I trained them to be able to do that. So I'm wondering whether I can go and teach there in Tembisa Hospital. We were shocked and appalled to read in the report how senior medical professionals and leaders of the hospital hid facts, misrepresented information, and tried to receive the Ombuds's investigation through cover-ups. Yo, my dear, I was so surprised how a hospital can really be an enemy of truth like this. It's shocking. We're deeply disappointed that these senior staff who are entrusted with providing care for the sick and vulnerable during a pandemic could not find the ethical courage to tell the truth and speak out. How can you deal with the human beings if you cannot uphold the truth? I just want to ask everybody who's listening. During the apartheid era, I understand that there were a lot of apathy. That umbilical cord still exists now. What is it that we can do as a community? The terrible fact is Shonisani is not an isolated case. The problem at this hospital have been going on for a long time, and there are other families who have suffered loss. I feel pity for them, really. I feel pity for them. Through the Justice for Shoni campaign that began after his death, we heard of many other cases. Today we stand together with the Ngube, Kiza, Singwayo, sorry for my pronunciation, Nguni, Twala, and Swat Boy families who either experienced the death of a relative or a major problem with care at the hospital due to failure of various kinds. We warmly welcome Ms. Ngube, Ms. Mkize, Ms. Nguni, and thank Ms. Twala and Ms. Swat Boy and Mrs. Singwayo, who cannot be with us but have provided a statement to be read out on their behalf. This report finally shines a light into what has been going on at Timsa Hospital, and it can help all of our families in seeking justice. The report can also help advance the aim of the Eastern communities and activities who have been campaigning for years to fix the hospital. You were doing a good job, but the only problem, my son had to die for me to know this. So it is very good to be joined today by Sibongile Jabalala, the National Chairperson of the Treatment Action Campaign, and Bishop Sakele Regimakuba, President Tembisa Transformation Forum. A warm welcome to you. We cannot just sit on the chair and wait for the government to do everything. Not to say, I'm not saying the government was doing good. What I'm saying is that whatever we do, we need to assist the government. We need to develop, to establish social movements for social coherence. We also want to take this opportunity to thank everyone who has been supporting the Justice for Shoni campaign for the last 7 months. For me, it's still like 7 days. In July and August last year, almost 26,000 people signed up to our first petition. I will say in my own language, as a family, Roribua. Our family, Shoni's friends, and many people across the world raised our voices and demanded justice for Shoni and for the many other people who have died at the hospital. We are one nation, which is a human race. This led to the National Minister for Health referring Shoni's death to the Health Ombudsman for investigation. I will still say bravo, because if it was not him, we won't be sitting here today. Even though there was a lot of pressure from the campaign, but he had a human heart to attend to this matter. So what is left is the implementation, which we are really waiting for it. Thank you for every one of you who helped us win the first battle and to discover the truth about what happened. Justice for our family is finally within reach. We must finish the job, and what means fixing Tembisa Hospital now. It is extremely urgent. We are fighting the COVID-19 pandemic right now. It is taking tens of thousands of South Africans. The report shows that the hospital failed in implementing the COVID-19 protocols, and if it is to be made fit for purpose, our dedicated medical workers and professionals must have what they need to combat the virus, including being trained on the protocols to effectively run a hospital saving a community of more than 800,000. Which is true, and also I cannot emphasize enough all the staff in the health institution needs to have ethical courage to tell the truth, because they are dealing with our lives. As a result, they must be trained on ethical leadership, and we need to establish ethical ambassadors there. If they don't know how to do it, they must come. We will assist them. In this time of crisis, when millions of people have no other option for healthcare, we can rebuild trust in our hospital and healthcare system. That is what we need. We need to rebuild trust, because we need those institutions. Without them, we will die. The Health Ombud's report sets out clear recommendations to ensure the hospital is better managed and resourced to cope with COVID-19. To fix the hospital, this recommendation must be urgently, underline it, implemented. Because really, to set an example, just imagine a camera was not functional. Whereas
a very good morning to you. This is the second hour of today here on ENCA. I'm Yuveka Rangapawa.